welcome everyone to Morgan's Medicine. Again, this is our second podcast. Still not 100% sure about the name, but we'll go with it for the time being. Today's guest is Dr. Dana Dameron. We're going to get into a little bit why we thought that he would be such a special guest for us to have on our second episode. So before any further ado, Dr. Dameron, thank you so much for coming by and letting us sort of ask you some questions.
Thank you for having me here. I appreciate the opportunity. So in terms of my background, I was born in New Jersey. I grew up in South Florida. I was always into health. I was actually pre-med and wound up switching my career into business, and later in life was a career change and decided to go back to medicine. After doing that, I actually became a DO, and I went to Nova Southeastern University, which is a university college for osteopathy in South Florida. I did my residency at University of Miami-Jackson. That's traditionally an allopathic residency where MDs typically go, so I was one of only a couple DOs that were in the program. The neat thing about it was the way Jackson is kind of set up is you work at University of Miami, you work at Jackson, you work at the VA, you work at Holtz Children's Hospital and also Mount Sinai. I'm a little bit of an odd doctor in terms of my background. When I went to residency, there was only about 4,000 of us in the whole country. My residency was in something called Med-Peds, which is a combined internal medicine and pediatric program. So I completed 2 residencies at the same time, and basically it was an extra year of training.
So do you still have an interest in peds then? Is that something that you still...
I still do a lot of pediatric work. The primary crux of my office, just because of the demographics of our area, is more driven toward a older population, certainly 30, 40 and older. But I also have pediatrics in the practice as well. I've worked all the way from the NICU and being at the high-risk delivery in the hospital and delivering and resuscitating the baby all the way to ICU for an adult, whether it's cardiac or neurologic.
So then back to Jackson and training. A lot of the physicians that I've spoken to that have gone through any time at Jackson basically come away with a wealth of experience because you get absolutely everything there.
Yeah, it's a really neat experience. I sometimes refer to it as a sink or swim residency. Yeah. So being that it's a Miami-based hospital, a lot of people that come in from out of the country, if they have a medical problem, that is the first stop where they bring them because there's just every specialty you can possibly imagine. As a result of that, not everybody's lucky enough to have the kind of care that we can get in this country. A lot of people come in with diseases and things you've never seen before. So as a result, I've treated Hansen's disease, which is bubonic plague. I've treated polio, tons of malaria, and other types of diseases that many people all through Jackson. It's also a trauma center, so you get an opportunity to be involved in surgeries and recoveries and things like that.
So for the last several years of your career then, it has been mainly internal medicine?
Yes.
Without a focus on peds, or peds have always been a part of your practice?
Peds has always been a part of the practice. When I completed my residency, I actually worked for some time at Cleveland Clinic. Primarily there I was doing internal medicine. After that, I went into a private practice realm where I worked with some other doctors and eventually decided I wanted to take on the responsibility on my own and open up my own practice, which is what's going on here.